Hey everyone, welcome back to my channel. Last week we did vitamin D, fat soluble vitamin, and so this week we will do vitamin K. Now vitamin K is another fat soluble vitamin. It is definitely stored in the liver, so it doesn't need to be consumed in high amounts. Now Danish biochemist Carl Peter Henrik was awarded a Nobel Prize in 1943 in medicine or physiology for the discovery of vitamin K, which is a coagulating factor. Now, what is vitamin K? Vitamin K belongs to a group of fat-soluble compounds involved in blood coagulation, bone development, and cardiovascular health. Now, vitamin K deficiency can lead to significant amount of bleeding as well as poor bone development and cardiovascular disorders. Now, calcium is also a mineral that is required for blood clotting as well. So it is also required for good bone health, right? Because calcium on vitamin D deficiency does lead to osteoporosis, like we've discussed before. But vitamin K is also a very major coagulation factor in our body, and calcium and vitamin K, they do have some pathways in our body that will work together to maintain the coagulation system. I will not go into detail at the moment, but we will discuss the extrinsic and intrinsic pathway, coagulation pathway in our body, which is basically the physiology of our body. So basically, in short terms, if you do have vitamin K deficiency, and if let's suppose you get a bruise or you get severe bleeding, the clotting factor or the post-thrombin time, it will increase and you will be bleeding for a significant longer period of time. Now you can see how dangerous that is, right? Like let's say your platelets count go really low, you can develop lots of blood bleeding disorders. So it's the same thing with vitamin K. If the vitamin K deficiency is there, then you can develop a lot of bleeding disorders as well, and you can have severe bleeding. If you let's suppose you get an injury or you get into an accident, you can actually bleed to death. So it is a very important vitamin in your body, and it needs to be consumed in certain amounts, in certain RDA levels. Now let's talk about the RDA level of vitamin K. Now it's different for of course it's different for children, different for female adults and male adults. Female adults is approximately 90 mcg, for male adults it's around 120 mcg, and for the pregnant females it should be around 75 to 90 mcg, pregnant or breastfeeding. Now let's talk about the dietary sources of vitamin K. So the first of is a vitamin K1, which is the dietary vegetable source of dietary vitamin K. That includes all the green leafy vegetables, and the most amount is actually found in kale. So kale has a very high amount of vitamin K. If it's consumed raw, that's great. Raw spinach has a high amount of vitamin K. Then there's cabbage, there's cucumber, there's lettuce, the green leafy lettuce. So all of these greeny vegetables, including the turnip and the shallots, they all have a large amount of vitamin K. Now if we talk about the animal sources, we do have some dairy. So egg yolk has a large amount of vitamin K as well. We have those butter, butter has vitamin K. Canola oil has vitamin K in it as well. And we also have some fortified sources of it. Now soya bean and canola oil also is a rich source of vitamin K. Of course, now we talk about fruits. Fruits, we have kiwi, blackberries and blueberries. They are quite rich in vitamin K as well. If you talk about dry fruits, almonds and cashews have a high amount of vitamin K and magnesium, and they're really good for your heart health as well as to decrease your appetite. Now, as you all know, the dry fruits, like nuts, almonds, cashew nuts and pistachios, they also have monounsaturated fats that basically decrease your blood sugar levels and your cholesterol levels and basically help with your heart health. Also, dry fruits have anti-inflammatory properties. Now, calcium, as we all know, is a mineral that is required for the for the bones, right? So what happens is vitamin D is required, it acts like a prohormone, as we discussed before. So what it does is it makes sure that the blood has a high level of calcium. And what does vitamin K do? Vitamin K makes sure enhances the calcium to be supplied to the bones, the heart, to all of these muscles that require calcium. Now we do have some observational studies that do show that K2 is more better than K1 in removing the calcium deposits from the heart, so it is better for your heart health. And so if you talk about natural diet, egg yolks, which are consumed in high amounts, each egg yolk contains about 69 to 192 mcg of vitamin K, which is a high amount of vitamin K, which contains vitamin K2, so which is very good for your heart, and therefore egg yolks should be consumed. So I think egg yolk can be consumed. If you find the eggs really heavy, especially in the summer season, I cannot consume a lot of dairy myself. So what you can do is you can boil an egg and eat the egg yolk, and only one egg yolk. Mix it with veggies. Now, dried basil, thyme and oregano, they also consume high amounts of vitamin K. And if you remember my last recipe, I was making roasted potatoes and I added a lot of dried basil, thyme and oregano to it. It's really good for your health, and it has a lot of vitamin K, which now we know is very important for blood coagulation. So, you can add as much as you want. I mean, this is like dried herbs, nuts, and these fruits, blueberries, blackberries, kiwi. Then you have, green vegetables, which we always talk about. Green vegetables are very good for your health. You add a lot of olive oil to your green vegetables, and since they're fat soluble, they will help you absorb, these fats soluble vitamins can be absorbed better with a fat base. So fat base could be anything like an olive oil or a canola oil. And also avocado is also a fat base. That's, you can have lettuce with avocado, and that's actually very good for your health. Now, if you do have vitamin K deficiency, let's say you get the test done and you don't have the normal levels, which is like 90 mcg for adult females and 120 mcg for adult males. So you are vitamin K deficient. Doctors will prescribe an oral medication called phytonadione, and it can also be injected under the skin. It is not injected into the vein or muscle though. Normal amount of vitamin K required in your body is about 0.2 to 0.32 ng per ml. Okay. Now you may ask, what are the tests required for the vitamin K deficiency screening? So we have prothrombin time, PT, we have APTT, and then we have fibrinogen levels. Now prothrombin time is usually prolonged, and as well as APTT is prolonged during vitamin K deficiency, where there's a lot of bleeding, severe bleeding involved. But mostly PT is used as like an indicator, prothrombin time. What could be the side effects of vitamin K? It could lead to like decreased appetite, decreased activity. It could lead to muscle stiffness. It could also lead to difficulty breathing, and it could also lead to pale skin and yellowness of your skin. Now, what will happen if you do have vitamin K deficiency? What are the symptoms? You will have excessive bleeding, you will have excessive bruising, you will have nosebleeds, bleeding gums, as well as blood in the urine or stool. You can have excessive menstrual bleeding for women, and you can also have arterial calcification and malabsorption in the GIT tract, and you can also have low bone density. You should just add green vegetables to your diet. Personally I love spinach and broccoli, so I do add a lot of spinach and broccoli into my diet. You can use broccoli with steaks, with chicken, and you can also have broccoli just like that. Just add some salt and pepper to it, boil it a little bit, and then brush with a little bit of olive oil. What you can do is you can add kale, spinach, and lettuce, and some feta cheese, some olive oil, and all of these greens together with some maybe grilled chicken, and make a salad. So that is really healthy and loaded with vitamin K and nutrients and vitamins, and really help you energize throughout the day, because it does decrease your appetite. It's really good for people who are dieting as well, because it decreases your appetite. You feel full. It's full of fiber, it's full of vitamin K, it's full of, I would also say, if you're adding avocado, full of fat as well. So good fats, it lowers your cholesterol, lowers your sugar levels, decreases your appetite, makes you feel good, and makes you full at the same time. Lighter version, like a thin crust pizza with less cheese, and add some mushrooms to it, and some thyme and basil and oregano to it. If you love burgers, you can have like a lettuce burger, which is like very famous these days. You can, instead of having the white bun, you have the lettuce as the bun. And let's say you love French fries, I have the better version, which is a roasted potato wedges version, which is just baked in the oven with olive oil, with oregano, thyme and basil. Diet is the most important thing. Exercise, your lifestyle, and also your mental health is very important as well. Keep your anxiety levels down, take a lot of rest, and keep your thoughts positive. Take care. Bye.